So dear friends, we will yesterday have we discussed about the pain of the tailbone. क्या कल हमने tailbone pain की बात की थी?
नहीं.
Yes or no?
No.
No.
No, sir.
Okay. So yesterday we have discussed about the scoliosis. Now we will discuss about the tailbone pain. हालांकि tailbone pain का मैंने कुछ समय पहले एक बहुत ही महत्वपूर्ण वीडियो डाला था YouTube पर, and that is really very wonderful protocol for the tailbone pain, because we have treated the tailbone pain for many patients just by using that very simple protocol. So maybe if I will show you right now quickly. Not possible because it's a very long video. Okay. So please go and see the video of tailbone pain. If I find the short video, I will put in the group. Right now, I am discussing another protocol of the tailbone pain, and it's really very effective. ये बड़ा ही effective है. What is the meaning of tailbone? Tailbone का मतलब क्या है? So the meaning of tailbone, we are going in the spine, the lowermost part of the spine. हमारे spine का जो सबसे निचला भाग है, और हमारे स्पाइन के सबसे निचले भाग में जो लास्ट की बोन है, मींस कॉक्सियल बोन और द कॉकिक्स बोन, दैट इज कॉल्ड tailbone. So generally there are 4 bone fusing together and forming the tailbone. 4 हड्डियां फ्यूज होकर एक tailbone का निर्माण करती हैं. And many times persons are having very severe pain of the tailbone. We can see here. So now if we see here, this is the last part of the spine, and we can see in this image, it is made by the 4 vertebrae. हमारी 4 vertebra के combination से बनी है, 1, 2, 3 and 4. So coccyx 1, coccyx 2, coccyx 3 and the coccyx 4, and these all 4 together are called tailbone. अगर आप डॉग में देखोगे और किसी एनिमल में देखोगे या फिर ऐसे एनिमल्स में देखोगे जिनके टेल होती है, this is very long and they are having too many bones in the tail. So let's see in this image. If you look at the tailbone of any other animal, I'm showing you the animal, some animals. Let's see now. We can see the structure of dog. In the dog, we are having very long tail, और इसकी काफी सारी इसमें बोन भी होती है. There are multiple bone. Human से ज्यादा बोन पाई जाती है in the dog. So why we suffer with the pain of the tailbone? There might be many reasons. कई reason हो सकते हैं. If we look at the structure of the spine, अगर हम spine का structure देखें, let's see now. In the spine we are having 4 curve. हमारी spine में 4 curve होते हैं. So the first curve of the neck is like this. The second curve of the thorax is like this. Third curve of the lumbar is like this. So this is the cervical curve. This is the thoracic. This is the lumbar. And then we can see the coccyx is like this. हमारे coccyx का curve ऐसा है. right? So suppose if the coccyx going in the misalignment, and suppose it's going further in, अगर ये और ज्यादा अंदर चली जाए, then start getting pain. कि मानो कि अगर किसी कारण से कोई ठीक से बैठता नहीं है, maybe some person is not sitting properly, so the coccyx is like this, उसका coccyx ऐसा है, और ऐसा थोड़ा और चला जाए तो it create the pain. This is the cause number 1. Cause number 2, falling injury. Suddenly someone sitting on the stool or the chair, and suddenly chair is not there, stool is not there, tap, falling down, and tailbone is getting injury. Sometimes there is a fracture of the tailbone. That is also creating the pain, right? So sometimes tailbone pain become very challenging. कभी कभी ये पेन बहुत ही चैलेंजिंग होता है. How can we work for this type of the pain? हम ऐसे पेन पर कैसे वर्क कर सकते हैं? So now we will be discussing the points we are using for the tailbone pain. The point number 1, very, very important point, that will be spleen 1. सबसे पहला बिंदु होगा हमारा spleen 1. The spleen 1 point is located at the great, हमारे great ऊपर लोकेट करता है. So we can see the image here. So whenever the person is suffering with a tailbone pain, we are putting the point here on the location of the spleen 1. We can see in the corner, this is the spleen 1. So we are putting one needle here. Why we are putting the needle on the spleen meridian, spleen 1, and why the spleen 1 is very effective point? So as per the imagination concept, अगर हम imagination के सिद्धांत के आधार पर देखें, so leg is doing the representation of the entire body. हमारा पैर संपूर्ण शरीर को रिप्रेजेंट करता है. And we can do the imagination of entire body here. Suppose the head region, neck region, chest. So knee area become navel. Then the area below the knee will become abdomen. Even the front part of the abdomen, even the lower back area. Then this area becoming the lower back area, and all the toes are exactly the lowermost part near the tailbone. Because the tailbone in the last, the tailbone is exactly in the last, so we are going in the leg also exactly in the last. जैसे कि हमारी tailbone के आखिर में दर्द है, हम ठीक उसी तरह से अपनी spine के last में जा रहे हैं. We are moving toward the last part of the spine, right? So when we treat the spleen, and we know spleen is very much effective as per many concepts. कई सिद्धांतों के आधार पर हम जानते हैं कि स्प्लीन बहुत ही प्रभावकारी है. So whenever you are putting the spleen 1 point, so we know the concept number 1. The timing of spleen in the organ clock cycle is 9 to 11 in the morning. स्प्लीन का जो समय होता है वो सुबह 9 से 11 होता है. It's a 9 to 11. That is the time of spleen. And opposite tide 9 to 11 p.m. is the time of triple warmer. And the triple warmer is the meridian. The other name of the triple warmer is also the spinal cord meridian that we know. So we can work on the spine with the help of this. And the triple warmer is the meridian. The name itself is telling triple warmer. Iska naam hi hai triple warmer. Means it's the combination of upper warmer, middle warmer, and the lower warmer. So whenever we are working on the triple warmer, and with the spleen one, we will be able to work in the lower part of the triple warmer. It will be working in the lowermost area. And whenever you are working on the triple warmer in the inside the triple warmer, we already know the energy of kidney is flowing. हमारे ट्रिपल वार्मर के अंदर किडनी की ऊर्जा बहती है. So whenever any person is suffering with a bone problem, we immediately think triple warmer, because as soon as the triple warmer activated, it will treat the bone. So spleen one has been considered as a very good point for tailbone pain. This is the point number one. Now the point number two will be the 33.12. तो अब मैं आपको बताऊंगा हमारा 33.12 पॉइंट है. The 33.1 is, I will tell you, one of the greatest point. Even the spleen one coming next. 33.12 is a very effective point. It's located here. Heart gate. If we see this bone, अगर हम इस bone की बात करें, just to do the representation of the entire body in this bone, what is the name of this bone? This bone is called ulna bone. Ulna. So we can do the imagination of head, neck, chest, navel region, upper back, means lower back area, lowermost area, and the last part of the spine. So whenever we are putting the needle here, it is working in the lowermost part of the spine, which is the tailbone. So 33.12. हमारे यह पॉइंट है 33.1. तो 33.12. As per the concept of TCM, we can correlate this point with the small intestine 8. हमारे small intestine 8 से हम इस पॉइंट को कंपेयर कर सकते हैं. So we can see here the small intestine point is here at the located at the elbow. So in the master tongue acupuncture 33.1, 2 point given. If this is the small intestine 8, we are putting the 33.1 to the heart gate point here. So what we do, if the person is having any type of the heart pain, अगर किसी व्यक्ति को heart की कोई भी problem है, we tell like this, okay, do like this, and we feel this process. Then we are feeling the bone here. फिर हम इस bone को feel कर. And just from this part, we feel the borderline and we put the point here in this part. So it is the one of the great point for tailbone pain. So this is the small intestine meridian. ये हमारा small intestine meridian. Now small intestine meridian again become very much effective meridian, because as soon as you put the point in the small intestine meridian, आप जैसे small intestine meridian पर point लगाएंगे, it will be treating the urinary bladder meridian, and the urinary bladder meridian supplying your spine. हम जानते हैं कि हमारा UV meridian spine को supply करता है. So SI8 is a very good point for tailbone pain. But when you are treating the tailbone pain, you have to remember, put the point exactly next to the bone. हड्डी को touch करते हुए needle लगाना है. It is the concept of acupuncture that is called the same for same. The meaning of same for same means if the problem of bone, put the needle exactly next to the bone. If the problem of the muscles, put the needle in the bulk of the muscle. I want to treat the heart because the name of this point is heart gate. If I want to treat the heart, I will see the muscle and I will put the needle in the muscle. But if I want to treat the tailbone, which is the bone, then I will go very near to bone and will put the needle exactly next to the bone. If the needle is touching the bone, it's good. Then you will achieve the good results. If you are putting the needle perfectly, then there are more chances to achieve the results. अगर आपकी needle एकदम perfect जा रही है, तो बहुत संभावना है कि आप का निशाना सही लगेगा. Now, as per the imagination concept, if you see the entire body, this is the uppermost part. मानो कि अगर हम शरीर की कल्पना करें बिना हाथों और बिना पैरों के, just do the imagination of body without arm and without leg, because arm and the legs are servant of this body. मैं कुछ उठाना चाहता हूँ, I want to lift something, yes, arm will follow. I want to drink the water, arm will follow the order. I want to walk, my leg will follow. So just do the imagination of entire body without arm and leg. So this is the uppermost part and tailbone is the lowermost part. So this is called the rule of axis. The rule of axis means if some problem is here, you treat here on the opposite side. If the problem is here, you treat here on the opposite side. So now the problem in the tailbone, we will treat on the DU20 as well as DU90 area, this entire area, DU20 to DU19 area. So DU20 to DU19 area is very, very effective for the tailbone problem because of the imagination concept. So now look at here. Let's see now. So be already aware this is the DU20 point. हम जानते हैं कि हमारा DU20 point. On the top of the scalp. So from the hairline, we will be going 5 chun posterior. Hairline से अगर हम 5 chun पीछे जाते हैं, we are getting this point DU20. Now from this point, so from this point, if we are going further 1.5 chun back, इससे भी अगर हम 1.5 chun back जाते हैं, that is DU90. So we will put one needle here, or anywhere in between. We can search the ahasi point. हम दर्द वाला point choose करके वहां पर needle लगा सकते हैं. It is also very effective point for tailbone pain. तो सारे पॉइंट हमने इमेजिनेशन के बेस पर लिए. नंबर 1 DU20 and DU19, spleen 1, heart gate, and they are the very, very effective point. This is the very effective point protocol for the tailbone pain. हम इस पॉइंट का इसका प्रयोग हम करते हैं. So let's see here this entire protocol. So we are going to read the tailbone pain, heart gate, DU20 to 19 and spleen 1, and add 55.04 and the 55.05. Done over. इतना किया तो काफी पॉसिबिलिटी है कि tailbone पेन कम हो जाए. So 55.04 and we already know these points here. These 2 points located here. So if between these 2 fingers, if we go 2 chun down, अगर हम इन दोनों उंगलियों के बीच 2 चुन नीचे जाते हैं, 2 चुन. And from this gap, if you go 1.5 tune down, both point coming in the same level, that is 55.04 and 5. As per the imagination, यहाँ पर भी हमने संपूर्ण शरीर का इमेजिन किया था. This is the head region. So these are the arms. Then the lower part of the body. And finally, if we go to this, here we are having lowermost part. So we are choosing 2 points here. So in this way, we have made the protocol for tailbone pain. Understood? Clear? Done. So now we are moving ahead to the next. Someone is suffering with the soreness in the lower back. एक व्यक्ति को लोअर बैक में सोरनेस है. What is the meaning of soreness? सोरनेस का मतलब क्या होता है? क्या मतलब है सोरनेस? कुछ तो तकलीफ हो रही है. Some problem is happening. Patient is crying, patient is shouting, oh, I am having discomfort, I am having stiffness, I am having pain. थोड़ा थोड़ा सोर हो जाना, soreness. Okay. Uneasiness, right? Perfect. If the person is having soreness in the lower back, we can treat this person with the help of 2 very, very special points. Number 1, lower back means lower back. Most the connected with the kidney. हमारा लोअर बैक एरिया किससे कनेक्टेड है? किडनी से कनेक्टेड. Because we already discussed, when the kidney in the disharmony, the person is suffering with the issue of the lower back area. तो इसके लिए हमारा एक स्पेशल पॉइंट है. We are having one very, very special point for the soreness of the lower back. Let's see now this point. The name of this point is kidney gate. So from the spleen 9, if we go 1.5 tune down, that is the location of kidney gate. पहले हमें spleen 9 पर पहुंचना है. We can feel the spleen 9 here, where the 2 bones, we can feel this is the bony junction here. So here the bony junction. So this is the location of spleen. ये हमारा spleen 9 है. From the spleen 9, if we go 1.5 tune down, so that is the location of kidney gate. But the other name of this point is Shengguan. इसी बिंदु का दूसरा नाम है Shengguan. तो spleen 9 से 1.5 tune down, this is the point. The name of this point is Shengguan. Person is having soreness in the lower back. Put the Shengguan bilateral. Patient ने कहा कमर में अजीब सा लग रहा है. Shengguan bilateral. So from the spleen 9, आपको spleen 9 से 1.5 के नीचे जाना है बस. Got it? Bilateral. So suppose here is the spleen 9. I will palpate the border of the bone, and this where the border of bone is ending. There is spleen 9. From here 1.5 tune down, that is Shengguan bilateral. This is the kidney gate. So because the name itself is kidney gate, so it's a very good point for kidney means nephritis, urinary problem, kidney failure, and lower back pain, infertility, impotency in erectile dysfunction, lower back pain. So now we will put two more points, then done, work is done. We already know the lower back soreness is connected with the kidney, and the triple Warren meridian is having direct connection with the kidney. Okay, very good. So triple Warren meridian having direct connection with the kidney. Let's do the imagination of the entire body in this arm, head region, neck region, chest region, navel area, abdomen, lower abdomen. This is the lower back area, lowermost. This is the front part. This is the lowermost area. If we are doing imagination of the entire body, the lower back is coming here. We will put the triple Warren point here, 2 points. So here we will put 2 points, 1 point here, 1 point here. From the triple Warren meridian, because these points are very much effective. So we put only one side. No need to put bilateral because these points are very, very effective. So what we'll do, we are going to put, we will see the knuckle. 1 point after the knuckle here. And 1 point when this gap is over. Here. So these are 2 points, very effective. This is the called 6 number point, and this is 7 number. So it is called 22.06, 22.07. So with the Shangguan, if we put this point, so ask the patient, okay, tell me which side you are having more soreness. आपको soreness right में है कि left में है? Patient ने कहा कि मुझे तो right में है. तो ये point आपने opposite में लगा दिए और दोनों पैरों में Shangguan लगा दिया. Done. Work is over. Very, very wonderful protocol for the lower back soreness. Let's see here. So in this image, you can see the 22.06 and the 7, 22.06 and the 7. And here from the spleen line, we go 1.5 tune, that is Shangguan. 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 Or the kidney gate. In the master tongue acupuncture, the number of this point is 77.18. इसका number is 77.18. Okay. Clear? Done? Next. Very good. You're understanding very, very fast. So I can move fast. So the next point I will discuss about the regarding the middle, we already have discussed middle back pain, what to do. We have discussed already many points. We are continue discussing the pain, the points of the various part of the spine. Right? No? Yes. Like 77.0123 right? For entire spine. I will suggest you, if you want to work on the entire spine, अगर आप पूरी spine पे काम करना चाहते हैं, your question is really good. That how to work on the other pain, the middle back pain, lower back pain. अगर आपको पूरी spine पर ही काम करना, you can do one thing. You put 1 point. That is called lower 3 emperor. You already know that. Lower 3 emperor will be working on entire spine. पूरी की पूरी spine में work करेगा. So quickly you can see the lower 3 emperor. So let's see, I will show you one video quickly. Suppose person is not having lower back soreness. Person is having soreness in the middle back, soreness in the upper back. You use lower 3 ampere. This is the lower 3. So we are discussing lower 3 ampere. These 3 points are on the spleen meridian. The first point is on the location of spleen line, just uppermost border of the tibia. So we can feel the depression here. This is 77.17. And the next point is just 1.5 distal. The name of this point is Shenguan, which is magical point for frozen shoulder as well. 77.17, 77.18. Now next point will be 77.19, which is just in between this lower leg or 7 tune up from the medial malleolus. So 77.17, this is heavenly emperor and this is earth emperor. If we go here, so we will find fortune up 1 point, that is 77.171819 or 20. So that is 77.20. And 1 tune distal, that is next one on the location of the spleen 6, that is 77.21. This is humanly emperor. So we have 3 emperor here: humanly emperor, earthly emperor, and heavenly emperor. The combination of the 3 points are called low 3 emperor. Sometimes we use Shenguan point in place of this 77.17 points. So we have 2 types of lower 3 emperor. In one, we have 77.17, 19, and 21. And in second, when we replace 77.17 with 77.18, and lower 2 points are same. Okay, how to insert the needle? So we can pull the muscle separate from the bone and gently put the needle like that. Here also, this is pull the muscle, make a space, insert the needle. So I have inserted these 3 needles here. So this is the insertion technique. Okay. You got it? So suppose you are asking, no, I want to treat the soreness in the middle back, soreness in the upper back. You use all the 3 points. Use lower 3 emperor, and I will suggest you when the patient coming on day 1, for maximum patient, you can use these lower 3 emperor, because lower 3 emperor are increasing the vitamins, increasing the hemoglobin, increasing the energies, and they are very less painful or no painful. Patient become very comfortable. Even we can use these point bilateral, right? These points are improving the body energy, body essence. Very good points. The most effective point is kidney gate, as I discussed with you. Okay. So now we are going to discuss if the person is suffering with a pain in the vertebrae. If the problem of the vertebrae, अगर किसी व्यक्ति को वर्टिब्रा की प्रॉब्लम है, वर्टिब्रा की प्रॉब्लम का मतलब क्या है? What is the meaning of vertebral problem? There are problem in some vertebra. Maybe this vertebra, maybe this vertebra, maybe there is formation of the osteophytes. या तो osteophyte का formation हुआ है, या there is some damage to the vertebra. So whatever happening, if देयर इज अ प्रॉब्लम ऑफ द वर्टिब्रा, अगर वर्टिब्रा की प्रॉब्लम के कारण है. So there are two very, very effective point. They are working on all the problem of the vertebra. हमारे बॉडी में दो बहुत ही महत्वपूर्ण पॉइंट हैं जिन्हें हम वर्टिबल पॉइंट कहते हैं. दे आर कॉल्ड वर्टिबल पॉइंट. और सभी प्रकार की वर्टिब्रा की प्रॉब्लम पर काम करते हैं, स्पेशली वर्टिब्रा ऑफ द लोअर बैक. ओके, सो these points are located. Again, I will tell you, whenever you talk about the bones, जब भी आप बोन की बात करते हो, bone means kidney, always first come in mind triple warmer, because triple warmer is the meridian. Inside the triple warmer, the energy of kidneys flow. So what we are searching the triple warmer meridian here. हमने यहाँ पर देखा कि triple warmer meridian यहाँ से start हुआ. Triple warmer 1, triple warmer 2, triple warmer 3 and 4, then 5, 6. The triple warmer meridian crossing this Olympic process. Then the triple warmer meridian is moving like this. So when we see the bone, on the border of bone, the triple bone meridian passes. हमारे हड्डी के border से triple bone meridian pass होता है. So we can understand from this bone, the triple bone meridian is passing exactly in the line of bone. So from here to here, if we put 2, 3 points randomly, 1, 2, 3, these points are very good for vertebra. ये हमारे पॉइंट बहुत ही महत्वपूर्ण होते हैं वर्टिब्रा के लिए. सो व्हाट वी डू, आइदर वी कैन पुट 3 पॉइंट, 1 चुन, 1 चुन, 1 चुन. They will work on the vertebra, or we can do one thing. Master 2 has told there are 2 points. The point number 1 is 2.5 चुन आप. हमारा पहला बिंदु यहाँ से 2.5 चुन ऊपर है और दूसरा बिंदु वहां से 2 चुन ऊपर है. They are called the point of vertebra 44.02 and 44.03. But I will tell you, you put the needle from here to here, anywhere, it will be working on the lower back, because as per the imagination, if we see the humerus bone, अगर हम humerus bone को देखें, so we can consider the entire body in the humerus bone, head, chest, abdomen, then this is the lower part, the lower back area. And in the lower back area, so we are treating the triple bone meridian. The triple bone meridian will be working on the lower back. So the 44.02 and 3 are called vertebra point. Now you will tell what about the other vertebra. Suppose if we put 1 point here, if we take this part, it will be working for the lower back. Take this part, it will be working for the middle back. If we take this part, it will be working for the upper back. But this part we are using very frequently for the lower back. So this is called the vertebral point. So now you can see in this image, अब मैं आपको एक image दिखा रहा हूँ. So the person is having vertebral problem and the lower back pain. So the point 44.02 and 3, we just seen that's a very good point for vertebra and the lower back pain. Other than that, we already know lingu is one of the great points. Lingu, हमारा lingu तो बहुत है ही famous. And one last point we will put, that is 11.11. In this finger we can see, we can divide the middle finger in 3 parts. In the middle part, we can see the 2 point, that is 11.11. They are very good for vertebral problem. So we can see in the finger here, जब भी किसी को लोअर बैक की तकलीफ हो, आप 2 निडल यहाँ लगा देना, एक इधर एक इधर. निडल लगाने की तरकीब तो मैंने बताई थी, फिर से बताऊं कैसे लगानी है. So first you look at the point here. In this length, take the 2 point at equal distance. 2 पॉइंट बराबर की दूरी पर नहीं, इतनी दूरी में. Then put the point here toward the small finger. Then we can put the point over the small finger like this, right? So person is telling, oh, I'm suffering with the problem in the lower back. And as per my reports, रिपोर्ट के अनुसार मेरी वर्टिब्रा में प्रॉब्लम है, उसमें ऑस्टियोफाइट बन गए, स्पॉन्डिलोसिस हो गई है, वर्टिब्रा में कुछ भी हो गया गड़बड़, और वर्टिब्रा में ही होता है, जब भी गड़बड़ होता है तो वर्टिब्रा ही में होता है, और स्पाइन में तो वर्टिब्रा के बीच में ही तो स्पाइन होती है। ओके, हम सारे पॉइंट अपोजिट में लगा देते हैं, 44.023, देन 11.11 एंड लिंग। अरे गजब का पॉइंट, 3-4 पॉइंट लगाए हैं, 5 मिनट के अंदर तो दर्द गायब होना चाहिए, विद इन 5 मिनट्स, दैट मच इफेक्टिव। आई विल रिपीट, लिंगो, आपने लिंगो लगा दिया, स्टार्ट यहां से करिए इस पॉइंट से, क्योंकि ये पॉइंट बिल्कुल भी दर्द नहीं करता, ये वाला, ये पॉइंट तो पता ही नहीं चलता। तो 2 पॉइंट लगा दीजिए यहां पर, ऐसे, ऐसे लगा दीजिए, एक यहां पर, एक थोड़ा ऊपर, थोड़ा और अंदर डाल दीजिए, फिर लगा दीजिए लिंगू, फिर ये 2 पॉइंट लगा दीजिए, 11.11, डन। एक्सीलेंट फॉर लोअर बैक पेन, इतना कम करने में ही लोअर बैक पेन चला जाएगा, और पेशेंट डरा हुआ है तो यही लगा दो केवल, एंड पेशेंट इज टेलिंग यू आई एम हैविंग, अगर आपको लग रहा है कि यार पता नहीं पेन राइट में कि लेफ्ट में, ये पॉइंट वायलेटर लगा सकते हो, यू कैन पुट दिस पॉइंट वायलेटर, लेकिन लिंगू वायलेटर नहीं लगा सकते, बिकॉज लिंगू इज वेरी हाईली इफेक्टिव पॉइंट, वी कांट पुट वायलेटर। This is also very effective point, avoid putting the bilateral, but this point we can put one here and here। कई बार मैंने ऐसा भी किया कि पेशेंट को बस ये पॉइंट लगा दिए, 2 इधर 2 इधर, बस हो गया, क्योंकि पेशेंट ने रिक्वेस्ट की कम निडल लगाने की, और पेशेंट अगर डर रहा था तो आई पुट दीज निडल एंड वी सीन वेरी गुड रिजल्ट विदाउट क्रिएटिंग ए इवन 1% पेन। ओके, सो डन फॉर टुडे, अब हम मिलेंगे कल। अभी वैसे कुछ बाकी तो है नहीं, फिर भी आपके दिमाग में कुछ हो, कुछ स्पाइन में हो बाकी, तो ग्रुप में डाल देना, तो मैं थोड़ा सा सोचकर उसे अगली क्लास में ले लूंगा, राइट? बिकॉज वी हैव डिस्कस मैनी थिंग्स एंड वी हैव डिस्कस near about all the things, but anyone is having anything in your mind, please let me know, so I will discuss, but it should be related with the spine। अगर आप बोलेंगे कि ये, it should be connected with the spine, right? Only spine। okay, thank you so much, see you in the next class। और it should be little common, आप अगर ऐसी चीज पूछें जो ना किसी ने सुनी है, ना उसके पेशेंट आते हैं, तो बर्थफुल नहीं है। लेट्स डिस्कस द थिंग which is more common, so you put in the group, right? I will see and we'll discuss। thank you so much, let's close the session।